Jonathan,
Sure.
we're challenging you.
Talk to me, Jonathan.
Explain it to us in 2 sentences. Go.
Sure. Okay. So, number one, it's going to make sure that almost all Americans can get a decent health insurance policy, regardless of income or pre-existing medical condition. And it's going to start to change the way we pay for medical care, so we get better care without paying quite so much money for it. So that's 2 sentences, a couple of dependent clauses, but, you know, 2 sentences.
Pretty
But it
good.
works. Pat Garrity,
I like it.
You're in the business. You guys are setting up exchanges in all 67 counties in the state of Florida today. How's it going to work?
Well, to be clear, the federal government's setting up the exchange, but we're offering
Right.
in 67 counties. What we've done, Joe, is we've gotten ahead of this curve. We understand that healthcare is going to be much more retail, and we built retail centers all around our state. These centers do sell business, but what they also do is we will resolve a claim for a customer face-to-face if they walk in. We have nurses there who do health risk assessments.
Now, you're not
actually
doing this all, though, because of the Affordable Care Act, right?
We did this starting ahead of the Affordable Care Act. Actually, we started our centers in 2006, so we were ahead of this curve. Our belief was that healthcare would become much more retail over time, and so it really dovetails with what's happening with the Affordable Care Act.
All right,
Jonathan?
let's look ahead, Jonathan, to what could go wrong. People can go online. They can get, I guess, paperwork to sign up at some Walgreens and different drugstores in different areas. What could go wrong, though? What are the glitches that are potentially roadblocks here?
Well, I think the most obvious glitch that everyone's going to talk about are technology glitches. You know, supposedly at 8 a.m. this morning, the websites, the marketplaces that the federal government is running for some states like Florida goes online. Some of the states' websites have gone online already. You know, I'll be pleasantly surprised if they all work. You know, when my kids went to go play Sim City, I think it was weeks before it was working, and this is actually more complicated than Sim City. But, you know, I remember that, you know, buying insurance right now is really incredibly complicated and messy, and you have to wait months to find out, and there's 6 months for people to open enroll. So if it takes a few weeks for the glitches to work out, you know, that's okay.
The actual paperwork doesn't take too much.
We've seen, by the way, Mike Barnacle, we've seen a layout of the sign up.
Healthcare.gov, yeah.
Yeah, boy, it's if you go through it and you have somebody take you through it, if it works, if there aren't the glitches there, they have streamlined it in a way that federal agencies are rarely streamlined.
Yeah,
they're planning ahead on that front.
I looked at the website last night, and it's fairly simple. But Pat, you're one of 34 states that don't have their own exchange. What's the upside or downside of not having your own exchange?
Well, we actually did lobby for building an exchange in the state of Florida. But the fact of the matter is the federal government is supplying the exchange for Florida. I think that puts a little bit of distance to our consumers. But what we've done is really focused on the consumer as a retail customer. We looked at Massachusetts, and we know that people go on the exchange and they don't finalize their decision while they're on the exchange. They want to talk to somebody, which is why we built these retail centers. We're already seeing thousands of people coming into our centers asking questions. I think the biggest need here is education. And so we've scheduled 3,000 seminars across our state to educate people. Regardless of where you are politically, the issue is we want people to be informed.
Yeah.
We want them to know what their choices are.
There's a 24-hour line as well. Jonathan Cohn and Pat Garrity, thank you so much.
Thank you, guys.
Really appreciate it.
Good luck today.